My name is Cac, and I'm with the dental hygiene program. I'm a second year student, and the one behind me is Martin.
Hello, I'm Martin Ambriz. I'm a first-year student here at the dental hygiene program.
And then my name is Linh Bui. I'm a full-time faculty this year at Fresno City Dental Hygiene.
Well, welcome, you guys. I've let you go ahead and just do your presentation, and then we can discuss or if we have any questions afterwards, we'll go ahead and ask you. Is that all right?
Yes.
Fantastic. Take it away then.
So for our dental hygiene program at Fresno City College, we are located at the Health Science Building, as you can see in the pictures. And as of right now, just a couple of pictures we have along the buildings. And the next one is the hallway that we have. The pictures to the top left is the hall frame that we have all the previous classes.
Got you.
Pictures on the right is the current class, the first year in the burgundy color, and on the first year in the blue color, and the second year in the burgundy color. And the bottom picture we have is just a tooth booth that we have selling $1 each items. In the next slide, we have the first year on the left and the second year on the right. The second year we took pictures in the clinic, which contain about 30 chairs for patient use. And we have a classroom of at 140. Yes, classroom 140, which also about 30 students. And we have clinics. As far as COVID go, we have barriers between the stations for patient safety. We also have infection control as far as COVID. We clean up before and after each patient use. And the last slide is about our services and the cost of the service that we have. There's also a flyer that we just made, one of the students just made, that contain all information that permanent to the making appointment, about the clinic, and the time of the cost of the services.
Yeah, and we're taking any patients that are willing to come. They can come to our dental hygiene office, and they can ask that they want a cleaning. And then what we would do is we would do a prelim on them to classify them what kind of calculus code they are. And depending on the calculus code, it would go to a first year if it's like a small case. But if it's like a hard case, they will go to the second years because they have more experience and stuff.
And if the patient come in as a family, say 8 members, they get the free of charge for the cleaning services. Also for student too.
So that's fantastic information. So the purpose of this college hour is really for your program to let the student body know what kind of services you have to provide, because it's a fantastic service for our student body. Dental cleanings are really expensive. This is a way to get really inexpensive dental cleanings, especially for people who don't have dental insurance. Scaling and root planing is very expensive. So $15 for a dental cleaning is fantastic. And a lot of the folks here, a lot of our students don't know that this is available to them. So I do have a few questions. So so when you do an initial exam just to see how much calculus or how much debris they have to do a cleaning, and then so is there a dentist on site during this time, or are they just is it just hygienists?
We do have a dentist on every year session that we have.
Yes, and then for those prelim patients that are coming to get access, they work, clinician works closely with the dentist because the dentist has to verify that patient, see what kind of code and stuff. Also, the first prelim is free of charge. We won't charge on the prelim So it's you can just come in, get checked to see if you're going to be a patient for one of our students. And then on your next appointment, if you decide to, or the patient decides to go with treatment, that's when we would do the $15 and any x-rays that need to get done.
Fantastic. So you do x-rays as well there.
Yes.
So
So
you
I
do
want-
radiography. Mhm.
Yes. So I want to add a little bit about code, explain a little bit about code and type. So if the patient haven't had their teeth clean for about three to 5 or 5 above, it's a heavy code. And then if the patient haven't had their teeth clean for about 2 years, it's a medium code. And then about 6 months to a year is like a less code. So we're using that to utilize the requirement that we have to have it done. So we need to have easy code, medium code, and heavy code.
Right. So if you have not been to the dentist in 3 to 5 years, you're going to have a deeper cleaning
Yes.
than you
Okay.
would if you had only had been in the last 1 to 2 years or within 6 months.
Yes.
So if it had been just 6 months, it's going to be a very quick cleaning. You won't have to do any root planing or scaling probably. So you would go to a first year student as versus 3 to 5 years where you may have some pretty serious calculus and possibly root planing. So you'd have to go to a more experienced student, correct?
Yes.
Yes.
Yes. Yes.
So
Okay,
we
fantastic.
We also have a service called interim therapeutic restoration, which is like a temporary restoration on the teeth. Say if you have come in with like a decay area,
Small, yeah.
a small
Right.
area, we can put a
So
temporary.
you guys can do temporary, are they like composites?
Yes.
kind of composite, yes.
So like fillings then.
Yes.
Mhm.
And
So that's fantastic. So my second question is about sealants. So I know that you guys do a children's like smile train or for sealants for the schools around the area. Do you still do that?
Yes, we still.
but
Okay,
we do on adult also, not just only for children.
right.
So
And so
depend on how the decay area look, we can either do sealant or temporary restoration.
right. So let me explain what a sealant is. A sealant is sort of a plastic overlay on the top parts of your molar teeth.
Correct.
And what it does is it prevents decay from happening, and doing it in children prevents decay quite a lot. So it's a really significant thing for children, especially kids who get cavities easily. And you guys do provide this to schools in the area and also to people that just want to come in and have them done, correct?
Yes, that's
Yes.
correct.
So, okay. And then you do fluoride treatments, it looks like. So that's cool. And there's no charge for fluoride treatments?
No charge. No charge.
Okay. And then interim therapeutic restorations, that's the cavity little filling thing. Is that correct?
And so we also provide arrestin, basically it's like antibacterial. We
Yeah,
put into the gum under the gum line to help the patient with their periodontal disease.
Right. So if you have gum recession, sometimes it's really deep and sometimes it's because of bacteria. So like an infection in your mouth. And so arrestin is what you would inject into the mouth, into that area to keep it from the gum from getting a deeper pocket or deteriorating more. So that's what interim therapeutic restoration is. And that's $7 per tooth. That's really cheap.
That's different. So ITR is different from arrestin.
Okay, so you do have, so how much is the arrestin services?
Arrestin included with the cleaning if the patient.
Oh,
Needed.
really? Oh,
Yes.
wow, that's cool.
And I would say in a private office, they charge one arrestin from $32 to $50 per
Yes.
arrestin.
It's very
Yeah.
expensive. Mhm.
Yes. And then over here, we just care for our patients and we don't charge anything.
That's fantastic. So,
So I have a question. I want to go back to sealants. I've never heard of sealants, and I understand you do that for children mainly, but if an adult comes in, you do a sealant if they have a lot of cavities, or why would you get your sealant?
No, actually not, because the sealants we place is only also on adult teeth. what happened is if the teeth have so many deep groove that need to be filled, so we prevent the decay
Prevent.
getting. It's like prevention rather than
Prevention.
It's
a restoration.
preventative, yes.
Yeah, preventative. Yeah.
Oh, I wonder, is this a new thing? I don't know. I have never heard of sealants.
Oh, this is not a new thing.
Oh,
It's not.
It's not. I've had sealants on my teeth and they're really cool.
So
oh,
because of the insurance purposes, so mostly some insurance pay only 15 to 16 years old and below.
Mhm.
Above that, they charge you. So mostly that's why we call it, like sealants for kids only because of that. But
okay.
mainly it's for everybody.
So it's just to protect the tooth from getting a
From
cavity?
getting cavity, from getting
Oh.
cavity. Yes.
Oh, okay. Oh, so is it recommended that adults come in and get your teeth sealed?
Yes. We have
Really?
doctor on the floor. So the doctor
Oh.
will look at your x-ray and look at your teeth and determine, okay, this one is good to have a sealant on before the student actually do it for you.
So I'm curious, what is the sealant? Is it just like what is it? Porcelain? What do they put over your tooth? What is it? I'm just curious what it's made of.
It's like a plastic material. It will last about 10 years.
Mm.
Yeah, if a properly placement.
Oh, okay.
Yeah.
It's an epoxy. Yeah, like a plastic epoxy.
Ah.
It fits into the grooves of your teeth and then it seals them from debris, from anything that you would eat. So it keeps, so if you have really grooved teeth in the back, if your molars have a lot of like pits and valleys, it keeps them from getting decay. So it's really cool. I've had it done before. I had it done in 2012. I do not think that my sealants are still there, but I had it done.
Yeah, to add to that, yeah, usually what happens is like food debris and stuff usually collect in those deep pits and fissures. So it's harder for you to remove. So what they would do if it's like really deep is they put the sealant, so it becomes more like a flatter surface. So it's easier to brush off and clean as opposed to trying to get through those. Because if food gets stuck there, it can lead to a decay.
Oh.
Well, it's not the food, it's actually the bacteria that would cause the decay, eating away. Yeah.
Gosh, I must be living under a rock. I don't think I'm familiar with sealants.
So please come by to our clinic and check out.
Yeah, and then
Okay, how long have sealants been around? I'm just curious. Like, how did I know I don't know about this. How long have you been doing sealants?
The program for sealants is started back in the 80s.
Yeah.
Oh,
I know I was born in the 80s and I have sealants on my teeth.
But that was
Gosh.
for the children's only.
okay. Okay, well, I learned something new today. I never heard of sealants really. Okay, good to know. Good information. And with fluoride treatments, I've heard different things about that. Sometimes they say there's too much fluoride in the water. And so, they advocate not getting fluoride treatment. What is the situation here in Fresno with our water?
As far as our water in Fresno, we don't have any fluoride treatment. Yeah.
Okay. And so I'm just, asking a lot of questions, but interim therapeutic restoration, that means cavity, like that's to fix a cavity?
If you have a larger than what was the sealants would be placed, then we use a restoration for intervals.
So ITR have fluoride. So it's really fluoride and help stop the cavity at that moment.
But do you also fill cavities? So that's also under that title?
No, and for any larger cavity that's require the dentist to come in and have to remove the cavities, then we're not doing it.
Oh,
This is a tiny, small, tiny cavity.
If it's a teeny tiny cavity, it's a pit, called a pit. They just fill, but if it's big, then they can't do it.
okay. You don't do
So-
any drilling, no drilling,
Right.
no
No.
anesthesia stuff.
Mhm,
Got it.
mhm.
We do
Okay.
anesthesia for
Uh, Yes, we do anesthesia for the comfort of the patient when we do scaling Brooklyn.
Yeah, root planing hurts real bad, so they would probably do some sort of shots.
Mhm.
Mhm.
Okay, I have a,
I-
oh, so I know you do preventative. Do you do any other things aside of preventative? Let's say like Zoom or teeth whitening or any of that kind of stuff?
We
We
do
sell
have
Whitening
the
strip.
whitening strip on the front office for sale.
Oh, okay.
And then we also have a nitrous oxide to help patients release anxiety.
Mm,
Yes, and then yeah, we have that service too, and it's no
Oh.
cost for the patient.
Oh, okay. So you sell, is it like Crest white strips
Yes.
or something along those lines?
Yeah, crest white strip.
Okay.
Yeah, and the
Very
pictures
cool.
that Kat showed with the hall thing, there's a tooth booth. You're more than welcome to come and you can come check out the products we have. Most of them are really affordable compared to if you purchase them at the store. Like Kat said, most of them are like $1. I think the most expensive is like $2. But anything 2 or lower and stuff. And we have like interdental aids too. So those are things between the teeth. Anyone's welcome to come and purchase those, and they can just go to the our front office and purchase them there.
So where in the health science building are you specifically?
So
Like where are we
Specifically,
looking?
So once you go into the health
First
science
one.
building, let me go back to this slide. This one, we are in the atrium.
Oh,
Will
yeah.
be to the right office of that atrium. The stairway.
Oh,
Right behind
Okay.
the vending machines.
oh, okay. Okay, that's good. Vending machine near the teeth things. All right,
With
all
all the
the
junk in
sugar.
it. Yep.
Yes, yes, okay. Well, I'll have to come check that out. Maybe come in and take, I mean, I've walked in there, but I've never specifically gone into your office. So good information.
Yes,
Thank
it
you.
is such a valuable service to the students, really. And I think that the more people know about it, the more they will come because, I mean, like I said, at my dentist's office, cleaning is $280. I mean, it's so expensive. And if you keep up on your teeth, so let's talk about that. So how much or how many cleanings should a person get a year? How many times a year should you have your teeth looked at in a perfect world?
In a perfect world, depend on how that condition is, with between 2 to 3 times a year.
2 to 3 times a year, depending on the condition of your teeth.
Yes. So if they have a lot of restorations, we recommend at least 3 times a year.
Okay, what about children? So when should your kids first come to the dentist? Like what age? And how soon or how many times per year starting from their first visit forward?
So for us is we have the minimum of 5 years old. We can have the children in as 5 years old.
Okay.
But as far as the outside world, it's gonna be once the children starting to have the teeth growing coming in, then as soon as that,
Yeah.
we can see the dentist.
We want to introduce at a younger age, you know, how the dental office look like. So the child not afraid of
coming
dental
in.
office. So just
Right.
have them visits and show them about, you know, this is the light, this is the chair, and then that's the beginning.
Very cool. Yeah. So you would say what, 3 years old,
3 years old, yes.
2 years old, just to get used to the dentist and
Mhm.
get in there so that they don't have any fear.
Yes.
Yeah.
And then starting around 5 is when they start having their first kind of cleanings.
Yes.
That's correct. Mhm.
Yeah.
Fantastic. Okay.
So can you address the importance of oral hygiene and health? I don't know if people in the room know that if you have problems in your mouth, it goes right to your heart. You know, if you don't address the cavity, I mean, rarely you hear on the news that, you know, we've heard young children have had infection in the mouth and they've actually died from it because of the connection from the mouth to the heart.
Oh,
Can you talk about that kind of how that connection at all?
Will be like the abscesses that are deep within like
Yes.
teeth. Like, yeah, there's they're rooted
Infection.
on the root and it can cause infections. And because the head really connects to a lot of nerves and veins, can also lead to the heart, but it also can lead to the brain, and that can also be fatal.
It's
So
more
the important
common
thing-
for it to go to the brain, honestly. Yeah.
Yeah, because there's so many like veins. There's like a nexus. We call it the dental plexus. So many veins surrounded near the mouth that an infection can just go into the bloodstream and actually go to the brain. So the important thing about that is that we can catch those abscesses. We can start doing treatment on them so we can lower the risk so that we don't get like any infections to the blood. I don't know if you guys want to add anything.
That's correct. It's actually worse if it's in your lower jaw. And any kind of abscess can cause severe issues and mostly brain issues, but it can go into your sinuses, it can go, and from there it's a straight shot to your brain for sure. So yeah, but it's more common if you have an issue in your lower, like the mandibular arch, which is this area right here. So, but yeah, but it can cause, so periodontal disease can be a marker for heart disease, which is what you were talking about, Miley. And just different kinds of, I guess, tooth disease are also markers for things like diabetes. And so if you have clean teeth and you have a healthy mouth, more often than not, you have a healthier body. So it's just better. Yeah. So, but periodontal disease is what is a marker for heart disease. So, and that's when you have really big holes around your teeth because your gums are not attaching to your teeth. They're eroding, or yeah, that's what that is.
Yeah, that's what we're trying to prevent, is trying to get to periodontal disease, because that's the irreversible part.
Yes.
Once it reaches the bone loss, then it's hard to get that back. All we can do is try to keep it from progressing further. The most that we would try to do is try to get you at a healthy tissue level. So if we can get you from, like, if we can see things starting at gingivitis, which is the soft tissue, that's the first stage of progression before it gets to periodontal. If we can get that healthy again, then that's reversible and we can get you to a healthy mouth. After that, it hits periodontal disease, then all we want to do is just preventing it from progressing any further.
So really quickly, let's talk about what causes periodontal disease.
That would be, you want to take it?
So it's going to start with the bacteria. So basically, when you're eating, right, you have food left over and stick on the teeth, become calculus. And the calculus also contains bacteria in there. If you leave the dog fed for a long time, it will start to eat away from the bone and the tissues.
We can go back a little bit about the plaque. First day is plaque that you're able to brush out with toothbrush. And then if you leave it there for a while, 7 to 14 days, it's become hard. When it's hard, we call calculus. And that point, you cannot brush out with toothbrush. And that's the point that we have to use instrument to clean it out. And then if it stay there for a while, it's become the periodontal disease.
Yeah, so with good oral health, like toothbrushing, if you disrupt like the bacteria buildup, that prevents the moving into gingivitis, and that's where you start getting calculus and it's irritating the gums. And that's where you start seeing like bleeding at the gums when you're brushing. And that gives you like a really warning sign. Maybe you should go see your dentist so that they can see how much calculus you have. So, because at that point, if you have calculus, like Mrs. Bui said, brushing alone is not going to remove that because it's hard. You're going to have to get instrumentation and a cleaning to remove the calculus. And then once we remove that, and then through oral instruction and flossing instruction or toothbrush instruction and keeping it at home, having a good oral health, you can get the tissue back to being healthy again.
So
Right.
I have a question for you. Do you recommend, or what kind of toothbrush do you recommend? Because I've been on the fence of getting like an electric toothbrush. And I've had people dentists tell me, because I tend to, brush it hard, I'm like a medium bristle. I feel like you've got to scrub your teeth. And I just want to know from your perspective, what do you guys use? What do you recommend to students?
For us, we recommend power toothbrush, electric toothbrush
Oh,
with the soft brittle.
Yeah,
Not-
never medium,
Soft.
soft. I know the answer to that. It's always soft.
Either soft or
Soft.
extra soft, because depend on your teeth condition. If you use medium a long time, your gum line will become recessed.
okay.
So you don't want that neither.
Yeah, I think one of our instructor pointed it out, like we use the hard bristle toothbrushes on the gaps of the tiles. And if that can take away that, just imagine how much you're brushing with the hard bristles on your teeth, what it's doing to your teeth as well. So a soft, if you are brushing, an extra soft will be better if you're doing manual. But I would go with power, because most powered ones, it has a warning signal that tells you that you're brushing too hard. So you just move back.
Okay, not what I wanted to hear. I like a medium toothbrush. I don't know why. I feel like I've just got to get in there and scrub away. Okay, so, okay, I'm hearing you. Maybe I'll go that route. I'm kind of old school. I just use the usual little toothbrush, but okay. Just curious what you guys all use. Thank you. Oh, flossing. How about flossing?
Yeah, maybe a daily routine. What a good, healthy.
For flossing,
No.
oh, sorry, it just went off a little bit on our side. For flossing, I would say whatever you use will be the best for you. If you're doing already something that's getting in between the teeth, I would stick with that. Because if you're already doing it, then changing that habit to something else that you're not going to use, it's going to be pointless. So I know like the string flossing is hard for me because I have big hands. So there's different dental aids, and you can find them in our tooth booth as well. I like the reach with the detachable ones, because I can reach in the back without putting my hand in there. So like I mentioned, whatever best interdental aid that you use that will get you to floss or get in between the teeth every day will be the best. You guys want to add anything?
Do we have more time?
So I'm curious, do you guys brush your teeth after every meal, or are you like, I'm morning and night, but I know people do brush after lunch too. Do you really push the 3 times a day thing?
You could, I mean, but the thing is, you have to wait in between after eating and before you brushing.
Yes.
Because
Oh.
after you eating, your teeth become more brittle
Oh.
because of the
Acidity.
acidity in the food. So if you brush right after eating, that will remove the enamel
Hmm.
faster.
Okay, so how long are you supposed to wait to brush your teeth after you eat?
About 30 minutes to an hour should be good.
Wow.
Yes, I found
Okay.
that the hard way this semester. I'm a first year. I've been brushing wrong this whole time. So
Oh,
now I have
wow.
like a routine. So I floss, and then to help remove whatever food is stuck in between the teeth, then I'll brush. And then I also learned that I was doing wrong because I was removing the fluoride from the paste by rinsing my mouth after I brush. And you're supposed to just spit as much as you can out because you want to leave that fluoride because it helps remineralize your enamel. And so I leave it on for like 20, 30 minutes, just like Kat said. And then I can rinse with the mouth rinse. And then I can eat if I wanted to eat afterwards. Or if I eat before, then I would have to wait the 30 minutes before I do that process.
Okay, this would be like a great comedy routine or a rap. Like you could rap it out and we would learn with a song. I think you guys should come up with the dental hygiene rap. That would be awesome. Because in the morning, I just brush my teeth. At night, it's like before you go to bed, but see, lunchtime, I would have never known this. I just think, you eat, got to brush your teeth. So I wonder how many people, if we did a survey, how many people would know this information? So I learned something new. It's great.
Now, I know that sometimes you guys don't have a lot of time for lunch and stuff. So there is a trick if you want to brush your teeth afterwards, you will want to bring the basic or the alkaline of your mouth. So there are some products out there that can, especially for people that have like, is it for halitosis?
Dry mouth.
Dry mouth, yeah. Biotin, yeah.
Biotin.
Yeah, you can bring back your the acid level back to like a more neutral, and then you can brush. That way you don't brush with acidity in your mouth.
Okay, so that makes me think of what foods do you guys say do not consume? It's bad for your teeth because, you know I like to put lime juice in my soup or something like something really, is that really bad if you, a little bit, or how much citrus is bad for your teeth?
If you do a
It's the-
concentrate acid, it's
Mhm.
different from you mixing with the water.
Yes. So if you use just a little bit, I just say moderate.
Mhm.
Moderation is good.
Yeah.
Because if you use too much acid, like straight up acid from the lime or the lemon that we have, that we normally use
Mhm.
for a long time, then your teeth become eroded from those acid.
Mhm. And is it true as you get older, your teeth get more discolored, or bad habits can discolor you, like coffee and red wine, or
It's mainly the bad habit. Yes.
bad
Yeah.
habits?
Mhm.
Okay. Yeah. It's hard to keep the teeth white. Okay.
All right,
Hey,
well,
well, you
is
guys-
there, oh, go for it, Miley.
No, I was just saying, good information, because, we brush our teeth from the time we're little and we're told to floss. And I don't know if I did fluoride, but I've heard different things about fluoride in the water, fluoride in the toothpaste, do this, do that. And I learned about sealants today. So I've missed, we all miss a little information somehow, some way. So good information. Thank you.
You're welcome.
Is there anything else you guys would like to share? If there's any questions anybody has that is on college hour right now, is there anything anybody would like to ask the professionals? Okay, was there anything you guys would like to share? Anything else?
I just want to share, like, for people that are thinking of coming to our office or clinic, sorry, for any kind of treatment, we are following regulations for COVID and stuff. So we are taking those actions. So if people are afraid because of COVID and stuff, we're following all these
CDC infection control.
CDC infection control. And then we have instructors that keep up with everything, and they're making sure that everything goes according to regulations.
So I have one more question. I know you've had dental workshops or Saturday for the community where you've really pushed in years past. Are you still doing those partnerships at all this semester?
We try to, because COVID, they keep pushing back a little bit.
Yeah,
Mm.
they suspended them for the meantime.
Oh, okay. Because I know you've done them in the past.
Yes.
But you're still doing the Smile Train with the elementary schools?
Yes.
Yes. So when is that?
As of now, because of COVID, they still haven't given us a schedule
No date?
or date.
Okay. So, but people can bring their their kiddos in to get them sealants and to also have teeth cleaning. So they don't have to wait for them to do it through the school.
No.
So fantastic.
5 years and up.
Yeah, 5 years and up.
Right, 5 years and
Okay.
up. Mhm.
And what are your hours again for being available? Can you show that on the slide?
You have awesome hours, you guys.
Oh,
8 to 9. I mean, it's fantastic.
wow.
Yeah, that's fantastic. So, so Tuesday, Wednesday, Thursday. So it's 8 a.m. to 9 p.m. Wednesday, 8 to 12 p.m. and Thursday, 8 to 5. So those are pretty good hours. Tuesday, especially, you're open for 13 hours. That's fantastic.
And that for just a springtime, because different semester we have different time for the clinic. So this may change during the fall.
Sure, but this will go through May.
Yes.
Yes.
Mhm.
Correct. Okay, fantastic. Okay, do you guys have anything else you want to add?
No, I mean,
Please come.
yeah.
We need patients.
Yeah, if you know anybody who is looking to see a dentist, but they don't know yet, or if they just need a cleaning, they can come to our clinic. We're more than welcome to treat them. And of course, I think that students are really appreciated because it does get a little difficult trying to find patients and stuff. especially due to COVID regulations and stuff, because we have to make sure that they're COVID-free or negative.
Right. So that's a good question. Do you have to, do you guys test for COVID there?
We don't test, but we are taking patients who have taken a test
Vaccination.
within the 2 days
2
before the
days.
appointment.
Okay.
So
And do
as
they
long as
need to
they
show their vaccination card?
Yes.
Okay. Okay. So, well, I just think it's a win-win situation. You know, it's good for you guys. It's good for the student body. You know, it's a really valuable service. Clean teeth or happy teeth. If anybody needs more information, they can come to student activities here on campus. We have the flyers here. We have the little flyers and also the larger flyers. I know that the bookstore has the flyers. I don't know if you guys distribute them anywhere else, but you probably have them all over campus. So if anybody needs any more information, they can certainly come and get the flyers. And if you need to make an appointment, you can call the number on the screen, correct?
Yes.
Yes.
Okay. Do you take drop-ins or do they have to call?
They have to call first. Yeah,
Okay, so call to make the appointment ahead of time.
that's correct. Because as a new patient, we have a they call prelim.
Mhm.
So
They have to get a little examination done.
Yes, that's correct, with the dentist.
Okay, well, it's such great information. This was really, really awesome. So thank you so much for all of the services that you provide. I mean, x-rays, sealants, even tiny cavities. It's really amazing, more than I thought you did. And I didn't realize you guys did root planing.
Yeah.
Wow, that's
Thank you so
amazing. I mean, root planing is serious. I mean, and it's very expensive, and they usually do it by quadrant.
Yeah.
So you do like, you know, one of 4 quadrants in the mouth, and each quadrant costs like a lot, like $100 or more. So if it's $15 and you get root planing, that's amazing,
Mhm.
really. So, okay, well, thank you very much. If there's nothing else that you guys want to discuss.
Thank you so much for letting us have this opportunity.
Absolutely.
Yes.
All right, bye.
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 How much hope?
All right. I know, really good. So like I said, you must be on mute. Oh, I think we're all done, Dr. Martinez. Bye-bye.